Well, I'm sure you've seen all the advertisements like I have and everyone else has for all these new injectables for weight loss, like Ozempic. Well, today we're going to find out a little bit more about them. How much does it cost? Is it right for you? What are the side effects? Is this the magic bullet everyone is waiting for? So if you want to know more about this, just stay tuned. Hey, good morning, everyone, and welcome to Scan FYI. Yeah, we have a very interesting topic today, and it's something I've wanted to talk about for quite some time. And fortunately, today my guest is Dr. Frank Borao, and good morning, and thanks for being with me.
Good morning. Thanks for inviting me.
So, Doctor, why don't you introduce yourself a little bit, and tell everyone exactly what it is that you do, and then we'll get into our conversation.
Sure. I'm a bariatric surgeon. I trained in general surgery, then did a fellowship in New York in bariatric surgery 25 years ago. And I've been doing weight loss surgery since then. And I've pretty much seen the evolution from the original medications to what we currently have today, in addition to performing all the surgical procedures for weight loss.
Well, first, let me say I didn't realize that bariatric surgery had been around for 25 years. I didn't
Since the
realize it was
60s.
such a
Since the
such a
60s.
long
Yeah.
time. But now we're seeing something completely different. These medications that were originally meant for diabetics, and now they're being used for weight loss. So kind of explain a little bit about what's going on here.
Yeah. I mean, early on, we had medications that would speed up the nervous system, things like fen-phen redox, and they worked well, but they had problems where they caused cardiac issues with the valves. So those were taken off the market. And about 15 years ago, 14 years ago, we started seeing these, what they call GLP-1 agonists. And an example would be Ozempic. And before Ozempic, there were several other ones in the similar category. But as time went on, they became specific because they would cause secretion of insulin, which would lower blood sugars and beneficial for diabetics. As a side effect, you would see weight loss. And these injectables are relatively convenient because it's once a week shot. Right. The earlier ones like Victoza were every day. So you literally have to take 30 shots a month, which was not the best thing. But now with the newer ones, it's once a week and they're very effective. And as a side effect, you lose weight. So as time went on, the company started developing for non-diabetic patients, essentially similar medication, but the indication is different. It's for non-diabetics. And the reason I say that is because when you're diabetic, for the most part, you should have insurance coverage. If you're not diabetic and you try to buy Ozempic, it's not going to be covered by insurance, and they're quite costly.
So obviously initially all of this was meant for people with diabetes, and that all makes sense. And I guess just seeing the unintended consequence of losing weight, they realized maybe we can parlay this into something else for people who want to lose weight, but want to do it I don't like saying the easy way, but it is kind of the easier way.
Well, there's no easy way. Typically when we see a patient, it's always lifestyle, behavioral changes, diet, exercise, etc. And if that fails, the medications are a good next step before surgery. We try to reserve surgery as a last resort. And even now, patients that have surgery and regain weight, medications are an excellent, add-on. But for the patients, it's a life-saving thing because if you're a morbidly obese, say 300-400 pound person and have several medical issues like diabetes, high blood pressure, sleep apnea, this could be life-saving. And being that weight is not sustainable as you get older.
Right.
So it's very important to lose the weight.
So who is this really targeted for? Who is best suited to these medications for weight loss, only for weight loss?
We try to follow the same guidelines as for surgery. And what we do is we look at what's called body mass index. And it's essentially, if you go on Google, type in BMI calculator, you put in your weight and your height, you'll get a number. And that number is your weight divided by your weight in kilograms divided by your height in meters square. Anything over 40 qualifies, and anything over 35 if you have medical issues. Now, if you're a 145-pound woman and want to get to 120, that's not really the indication. But many people are doing that today to lose weight, to lose 10, 15 pounds, which is really not a good reason to use it.
All right. So this is still probably more suitable for someone who maybe wants to lose 50, 60 pounds?
Oh, yes. I mean, you can lose easy 40, 50 pounds on the medication. It does happen. But when you look at the overall excess weight loss, in general, medications are between 5 to 25% excess weight loss. When you compare that with surgery, it's much less. When we do sleeve gastrectomies, that's between 50 to 65%, and bypass gets you closer to 70% excess weight loss. That's in general. So the medications do afford weight loss, but it's not close to what surgery would do.
So even with the medication, is it fair to say that, we're still talking about a lifestyle change? There's no substitute for having a good lifestyle.
Correct. If you rely on the medications, you're not going to have healthy eating habits. You're not going to exercise. Just like surgery, it's not going to give you the best optimal outcome.
Right. And I feel like some people, there's always think that, well, I can take this medication and, have my cake and eat it too. But the reality is it's really no different than anything else. You still have to make some lifestyle changes to lose your weight, maintain your weight.
Absolutely. That's why in any bariatric program, it's multidisciplinary. We have psychologists, we have nutritionists, we have support groups, because without support, you're going to go back to the regular routine that you were before surgery or medications. So, and I've seen many patients on medications, both before and after surgery, and it's the same path. If they don't have support or continue exercising and dieting, it's not going to be successful.
So what are some of the side effects, Dr. Borao, that people could expect with taking these injectables?
Yeah, most people that we see, they get nausea persistent. They can have vomiting. They can get diarrhea or constipation. Also, patients that have bad gallbladders may not be a good idea because it can give you gallbladder attacks. We also see patients develop pancreatitis from the medication. So if you have a history of pancreatitis, it's a relative contraindication. And we've even seen bowel obstructions and something called gastroparesis, where the stomach stops contracting and the food will sit there for hours and hours. Now, are these reversible? We don't have a lot of data because they're relatively new in terms of taking these medications in non-diabetics. But long-term data is still out. Time will tell, but we know that for the time being, these are some of the complications.
So you really have to, I'll say you really need to be qualified by a medical professional to see if this is going to be right for you, or are people just like, I want it, and they wind up getting it?
Well, you should go to somebody who is qualified in bariatric surgery or bariatric medicine. And, you definitely need supervision. It wouldn't be a good idea just to take an injectable because, number one, you have to have the proper dose, and things get upscaled depending on how you do. You have to know how to monitor patients. So I recommend you see somebody who's credentialed and certified in weight loss management or surgery.
All right. So for someone who thinks, well, let me just go to my primary care doctor, and that might not really be your best approach. You really, from listening to you, that's not the best way to do this.
Well, a primary doctor may give you a prescription. And like I said, you may not have the prescription fulfilled. And then it becomes a cost issue. And if you do get it fulfilled, you have to be closely monitored because there could be subtle signs. And we've seen patients come into the hospital with issues directly from the medications because they're taking either very high doses, they're not really being monitored, unregulated. And I've seen patients where on some of the meds, you can actually adjust the dose, like on Ozempic, and they took much higher dose than they should have on a routine basis, which caused some issues.
So I wonder, why this is my personal curiosity, because I didn't realize this for a while, that this is something that you inject. And I always wonder, why can't we just take a pill?
You can. There are also pills on the market.
Oh,
there's a new medication called Qsymia. You can take that. That's a capsule extended release. So there are medications, by pill. You can also take things like phentermine. But nonetheless, medications are out there by mouth. Another one's all called Contrave, which will decrease your cravings for food. It works in the brain from the hypothalamus. But they're a little different mechanism of the way they work, a little different mechanism of action.
so that was actually so how do these work? What is making, so you just said it's reducing your craving for food?
Yes, you have early satiety. You have a meal, you feel full very quickly. Some of them is because the stomach's not contracting like it should. so food's sitting in the stomach and you feel full quickly.
Right.
And some people will also have persistent nausea. They'll have a small meal, they'll just feel completely full and they won't eat anymore.
Okay, now let's talk about the cost, because I thought that was actually very interesting. Because this is, you know, having this medication for diabetes is entirely different. There's an insurance factor. On your side, it is covered. But now you want this for weight loss. This is a very different situation.
That's right. These medications typically cost for the injectables between $850 to $1,100 per month. So without insurance, it's pretty cost prohibitive for most patients.
Yes.
Now, for the patients that are not diabetic and still qualify regarding their weight, you can attempt to go to the pharmacy and fill the prescription, but if it's not covered, you can actually contact the manufacturer. And things like Mounjaro, they can give you almost 50% off. It comes out to around $550 a month if you wanted to pay out of pocket.
Can I say that's still a big chunk of money?
It's still a big chunk of money, very big chunk of money, but it's half of what you would normally pay.
Wow. Wow. So I think, you know, you have to think long and hard about, is this right for you? Not just emotionally and physically, but financially. Because this is not like you're going to have a $2 copayment.
Right. And the other thing is, what happens when you stop taking the medication?
Yes, my next question. Yes.
Right. It's for life. So
Oh,
if you stop taking the medication, the chances are you'll regain the weight. Unless you altered your lifestyle to the point where you're eating the small meals, you're not cheating in between, you're not having a lot of sweets that put calories on. But most patients will actually regain weight once they stop the medication.
well, if it's reducing your cravings and now suddenly, well, you stop it and yeah, that's
We'll come
okay.
back.
That's interesting. So just like when you're diabetic, you're on medication for life. And so this is, and I have a feeling people listening out there, you might not have realized that this was a lifetime commitment.
Yes, and that's the issue, that we don't have enough data yet because there's no long-term studies.
Yeah.
They're short-term studies, but essentially, if you stop taking the medication, you have a good chance the weight will come back on.
So how do you feel about this as, you know, as a doctor specializing in this whole in things regarding weight loss? Do you feel like this is a good solution? A
I think it's good
reasonable
for certain
solution?
patients. I think it's good for certain patients. I think for some of our patients that had weight loss surgery and regained weight, it's very good. I think for patients that are not at extreme weight, but they have medical issues, it's good. But it's not good for the person that wants to lose 15, 20 pounds and they're running to take the medication.
Right. Right. All right. So like everything there, not everyone, this is not right for everyone. And I just feel like too many people who think, well, I just want to lose 20 pounds. I just want to lose 25 pounds and that's it. This is not the way to go. This is
Absolutely.
not the way to go. Very interesting. Let me remind everyone listening that Dr. Barao's info, well, his contact info, it's in the description. If you want to know more about this, if you want to reach out to him, you know, please do so. I think this has, you know, really been very enlightening for a lot of people. Certainly the cost factor. I'm a little bit in shock myself right now. And knowing that it is a lifetime commitment, which I never even gave that any thought. Wow.
Another thing is, now these medications are going to go up in price because the demand worldwide is tremendous.
Yes.
And they're going to actually increase, and they're going to be more restricted to patients that qualify for them.
As time goes on. Yes. Yeah. Yes. All right. Not the magic bullet. There's still no substitute for a good lifestyle. That's, I guess, number one. But I could see where if you need a little extra help, that's another story. But if you're looking to lose 15, 20 pounds, I think there's better ways to do it, right?
There certainly is. That's why in our center, when you come in, we speak to everybody, give them all the options. And we have the nutritionist there at the same time that we're seeing patients. And also, like I said, we have psychologists and behavioral therapists. So it's got to be a multimodal practice. And we do what's best for the patient. You know, like you said, there's no magic bullet. Everybody's different. and you have to be assessed as an individual.
Okay, well, God, Dr. Borao, this was very interesting to me personally, and I think for our listeners out there. I'm very appreciative of you coming and speaking with me today. Thank you.
Well, thank you so much.
And I hope you all listening out there learned a thing or two. And again, if you want to reach out to the doctor, all of his info is out there. All right. Well, once again, remember, if it's important to you, it's important to us. I'm Andrea Tarr, and we'll see you next time on Scan FYI. Bye, everyone. Thank you, Doctor.
So long. Thank you.